Welcome to the MamasteFit week-by-week pregnancy update. We are now in week 33 of pregnancy, and in this video, you're going to learn what to expect for your baby, what might be going on with you, and then I'm also going to share how my 33rd week of pregnancy has been going, because I'm currently pregnant with baby number 4. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I'm currently pregnant with my 4th baby, so I have a lot of experience with being 33 weeks pregnant.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife and mom of 3.
Before we dive into what to expect during week 33 of your pregnancy, I want to share that my book, Training for Two, is now available for pre-order. And depending on when you're watching this, the book may be available now because it comes out September 10th of 2024. Training for Two is all about how you can use prenatal fitness to help support a strong pregnancy, a pain-free pregnancy, and also help you prepare for birth. And there's even some stuff in there on postpartum as well. So if you're trying to figure out what should I be doing to prepare for my birth, that book has a ton of stuff within it. In addition to our book, we also have 3rd trimester specific programs to help support you in the final months of your pregnancy as well, with childbirth education, pelvic floor preparation, in addition to fitness programs that are really focused on birth preparation also. So what can we expect with baby in week 33?
So week 33, baby is the size of a lunchbox or a pineapple. So not only are you probably eating a lot of pineapples, but baby is the size of a pineapple at week 33. Lunchbox, I think it's just a normal size lunchbox. None of those like the huge Yeti ones, like obviously not that big, but normal size lunchbox. During the week 33, your baby's immune system is continuing to develop with the aid of your antibodies. So the antibodies that you have running through your system is being transferred to baby through the placenta, and these are helping them build their immune system. Baby's bones are starting to harden except for the skull bones. Those ones we need to remain soft so that they're able to move and adjust to go through the birth canal. Baby is continuing to grow while adding on some body fat, so their skin is less translucent and they're having their little rolls starting to form. And then the last thing, if you remember, lanugo is that fine hair that formed on baby, and this is one of the things that kind of helps keep baby warm in the womb. But it is starting to fall off now around the 33rd week, and it's going to slowly continue to fall off until birth. Baby might still have some on their body depending on when they're born, and sometimes they just kind of keep it around their shoulders and upper arm area. But for most babies, they come out with little to no lanugo. That's really all that's happening with baby, but for you, the amniotic fluid volume that you have now in your belly at 33 weeks is about the peak amount that you're going to have throughout your entire pregnancy. Starting around 33, 34 weeks, the amniotic fluid amount slowly decreases until birth. And this is just kind of a normal phenomenon that happens. Other things you might be experiencing is that vaginal discharge may have increased around this time, and it's usually more of a white color due to the increased estrogen that's running through our bodies. So you might feel more discharge as well as it being white. That is normal. If you start having any red, streaked, or a mucusy or jellyfish kind of consistency, this could be your mucus plug that is coming out. As long as you're not having any sort of contractions or any risk factors of preterm labor, usually there's not a problem. It's just your body is preparing for birth, but always helpful, especially if at 33 weeks you lose this mucus plug, reach out to your providers to make sure that everything is okay. If you're also having that increased vaginal discharge, but it has a fishy odor or it looks almost like cottage cheese, these could be signs of a vaginal infection and definitely a reason to reach out to your provider. And then the last thing is Braxton Hicks, which I feel like a lot of people do experience just in the 3rd trimester normally, but it can increase as you get closer to term because these are practice contractions. Your body is prepping for labor, especially if it's not your first baby. I think Braxton Hicks are a little bit more common, but there are things that we can do to kind of help increase our comfort or decrease the amount that you're experiencing. One is just hydration. Make sure you're drinking enough water as well as electrolytes and minerals. A belly band can help provide support to decrease the amount that you're feeling these contractions because sometimes it's just irritability from just being up on your feet all day. Another reason it could be you just need to pee because your bladder is full and this could irritate your uterus, or maybe you just had a really big meal and that can be irritating your belly, which is where your uterus is also located. So there's different reasons for Braxton Hicks that are happening, but there might be some things to kind of help increase your comfort. But other than that, how are you feeling, Gina?
I'm having a lot of Braxton Hicks. My midwife did say, like, if you experience a lot, let me know. And I'm like, well, how much is too much? When should I let you know? So usually I have them mostly in the evening. It's usually when I'm the most fatigued and getting ready for bed. And anytime I have to pee, I like really feel them. But it's just like a sudden hardening and then a sudden release. Sometimes it's more uncomfortable, especially if I'm on the more dehydrated side. But it definitely feels very different than a labor contraction. And I think deep down, you know that it's just Braxton Hicks. But it can still be concerning when it's like all day and you're like, wow, I'm really uncomfortable. I also find that it tends to increase during activity. So when I'm walking, like especially if I'm working out, like I'll feel them a lot more. But generally, as long as like there's no blood, it's not turning into a contraction at this point where it has that kind of wave-like sensation or coming at like a set frequency, I'm not really concerned with having Braxton Hicks. If I'm experiencing them during my workouts and it's becoming uncomfortable, I'll just kind of lower intensity or rest a little bit more, and that seems to kind of mitigate them. But generally in the evenings, I feel them a lot. I don't think experiencing a lot of Braxton Hicks means that you'll go into labor sooner, though. But I don't know. I had a lot with my last pregnancy, and I was 41 and 3 when I went into labor. So I think that I will probably still be very pregnant. And we will probably have a 41-week video for this series. But who knows? But overall, feeling pretty good physically. I've been doing a lot of exercises to help support my pelvic comfort. So pelvic stability exercise, specifically focusing on the SI joint area. And so I've been relatively pain-free. Occasionally I'll have like a slight achiness to it, but overall, like it's not bothering me at all, which is pretty amazing. I'm very happy with that. I've been doing a lot of movements that are focusing on helping with pelvic balance, so strengthening the glute and quad on my right side, the adductor on the left, and then also mobility exercises to improve how well like my hips move, in addition to myofascial sling exercises to help strengthen the musculature that supports the SI joints. We incorporate a lot of pelvic stability movements within our prenatal programs, especially the third trimester. That's when most of us are starting to feel that discomfort. And we include it in the prenatal strength program and in the prenatal on-demand programs as well. Because pain is not a requirement in pregnancy, we can absolutely be relatively pain-free. Obviously, we're going to have some discomforts here and there. Like I'm pretty uncomfortable in the evenings because my belly is in constant Braxton Hicks, but I'm not in pain, which I think is a misconception when it comes to pregnancy, is like there are these mandatory pains that you just deal with. And that's not true. Like we don't have to be in pain if we don't want to be. My husband is also starting to focus on his birth preparation because labor support can be physically intensive, especially if you are planning to have like an unmedicated birth where your partner is going to have to be physically supporting you for a long period of time. And so he's started doing a lot of like chest strengthening exercises because during my labors, I really like hip squeezes. So every other day he's been doing a chest workout to build up his tolerance to squeeze my hips, starting even now at like 33 weeks, which is pretty funny. He's been complaining that his chest is really sore from all the workouts that he's been doing in preparation for our birth. But it is really nice to know that he takes preparing for our birth together seriously. And we've also started kind of preparing our house for baby as well, trying to figure out what it is that we need for this baby. I feel like I'm missing some key thing that I'm like, oh, that was really important. Because we mostly have everything from previous kids. We just need a car seat, I think. But even maybe we don't. I don't know. We'll see. Prime Day is coming up, so I'm going to order it then. But yeah, just trying to figure out like, what are we missing? Do we need anything else? Getting the house ready and just kind of preparing together to meet our baby in anywhere from 4 to 8 weeks. So I hope that you're also feeling pretty good in the 33rd week of your pregnancy as well. If not, we have a lot of resources for you. If you are suffering from any sort of pelvic pain or discomforts during your pregnancy, there's usually a lot of movements that we can do to help resolve those discomforts. And we have a ton of resources in our blog, on our Instagram page, on our YouTube. And so if you're having trouble finding some of those resources, feel free to comment below to let us know what discomforts you are experiencing, and we'll direct you to our resource so that you can find relief. Because again, pain is not a requirement of pregnancy. If you want more support throughout your pregnancy, check out our third trimester specific program options. We have our third trimester prenatal on demand program, which are going to be those full-length workout videos that you follow and work out with at the same time. Our third trimester program includes strength workouts and includes birth preparation workouts, pelvic floor release workouts, in addition to birth partner workouts where you and your birth partner can practice labor positions and comfort measures together. If you prefer to work out at your own pace, we do have a very similar program structure in our prenatal strength program, which is going to be an app with a list of exercises and short demo videos. And this is also going to include strength workouts, birth preparation, pelvic floor, and those birth partner workouts as well.
And if you're still looking for an online childbirth education course, we have our childbirth education course in a condensed version that covers labor positions as well as labor comfort options and pushing. Or we have our complete childbirth education, which covers all of the same things, as well as different birth options, as well as birth interventions, things your partners can do to support you, and different induction methods, what to expect at the hospital, and a little bit of postpartum and newborn. In the courses, we discuss the science of labor and birth to help take away the mystery, to make it less scary when we approach it, and we find that it helps make coping with labor easier. And you can check out all of our offerings on our website at MamasteFit.com and use code YouTube10 to get 10% off.
And you can bundle prenatal finish and childbirth education together to save an additional 15% off as well. So check out all our offerings on our website. If you're not sure what the best option is for you, comment below and we're happy to direct you to what we think might be really helpful.